Dry February is coming to an end tonight. The Canadian Cancer Society's campaign asks people to stop drinking for a month to reduce the risk of cancer. But the pandemic has spiked levels of anxiety, depression, and loneliness. So more Canadians are turning to alcohol as a coping mechanism. As Katelyn Wilson reports, that's boosted the business of booze.
When the pandemic first hit, we were quite worried, just as everybody else was.
With alcohol deemed an essential service, financial worries quickly eased for Saskatchewan liquor store owner Philip McKellery as sales started to soar.
It was dramatic.
Within the first couple of months, McKellery says sales shot up 40% and deliveries increased threefold. Since then, he says both have remained steady.
It wasn't a shock because people are stuck at home, not being able to do anything.
According to the Canadian Centre on Substance Use and Addiction, since the pandemic began, 25% of Canadians between 35 and 54 say they're drinking more, pointing to factors such as stress, boredom, and lack of a regular schedule.
We're certainly seeing increases in the number of people requiring admission for alcohol withdrawal. And these are people coming from across the socioeconomic spectrum.
Mental health and addictions expert Peter Butt says increased access to alcohol combined with social isolation and anxiety is leading to unintended consequences.
People that were perhaps episodic drinkers have become daily drinkers if every day is a Friday or a Saturday. And then it gets to a level where it can shift to the point that they're drinking to avoid withdrawal.
And you don't have to look far to see how accessible alcohol has become. In Alberta, Willow Park Wine and Spirits says when the pandemic hit, it shifted primarily to e-commerce and delivery.
We went from having 5 deliveries a day in Alberta to 200.
But experts worry the hangover from the alcohol boom could linger long after the pandemic has ended. Katelyn Wilson, Global News, Regina.